We just lost our quorum, so what we're going to do is pivot. And actually, the very first thing that we're going to do, and maybe we'll regain quorum, is we have one person who is signed up for public comment, and Mr. Steve Ryder, about RS 2024-351. So, Mr. Ryder, you're recognized.
Thank you very much, Madam Chair and members of the committee. My concern about this resolution, it's really overly broad. I want to remind everybody that the Cumberland River is a national waterway, and it's supposed to have free access to everybody. I don't know how many people are around, but in 2008, the Metro Council actually went for a swim in the Cumberland River. So I just wanted to point that out. In the resolution, in the preamble, can you hear me okay? I don't know.
Yes.
Okay, good. Wasn't sure. In the preamble, it says on the fourth whereas, and it talks about the recent disappearance of Rodney Strain. And I don't know if that's really appropriate in this resolution. To me, if you really want to learn about Riley Strain or whatever else, you can probably do that. Find out how he became separated from his friends. When he was at the bar, was he told to leave and go out the front door? Or was he grabbed by security and thrown out in the back in the alleyway? And you can find out that through the poll cameras and everything else. We've only seen video. It was like, oh, this is the last place he was seen. But the security plan in the bars is really important to understand. Because if he was tossed out in the rear as a drunken tourist and didn't know where to go, and his friends, they got separated from his friends, so the friends go out the front door, he's wandering down the alley, then I don't know where he's going. If you really want to find out about Mr. Strain, you can do that. But not in this ordinance, or excuse me, in this resolution. There's ways of addressing that. So I understand this is going to be deferred. I've talked with Mr. Coupin, and he will be working on this, but since this is regarding public safety, I thought this was the appropriate forum to bring this up. Thank you very much.
Thank you very much. Since we've regained our quorum, we're going to go ahead and get started with our legislative agenda. It's very brief. And our quorum consists of myself, council members Bradford, Gregg, Huffman, Kimbrough, Sepulveda, and Weiner. And so as far as an agenda is concerned, I do have several items on consent. I have item number 3, which is RS 2024-360, item number 4, item number 5, and then skipping over to item number 7. Does anybody need any of those items pulled off of consent? Okay, seeing no hands raised, we'll go ahead and get started with our consent agenda, and then we'll pick up the 2 items that are not on consent. First item on consent is RS 2024-351, or I'm sorry, RS 2024-360, Porterfield, Toombs, Evans, and others, approves Amendment 2 and appropriates additional grant funds from the Tennessee Housing Development Agency to the Metropolitan Action Commission for Low-Income Home Energy Assistance Program, or LIHEAP, services to assist families with energy costs. Item number 4, RS 2024-366, Porterfield, Toombs, Evans, and others, approves an intergovernmental agreement by and between the Metropolitan Nashville Police Department, the U.S. Army Corps of Engineers, for extra duty police services. Item number 5, RS 2024-367 by Porterfield, Toombs, and Evans, approves an application for a community-based traffic safety enforcement and education grant from the Tennessee Highway Safety Office to the Metropolitan Nashville Police Department to conduct sustained, highly visible, and proactive traffic enforcement, addressing impaired driving, distracted driving, occupant protection, older drivers, teen drivers, bicycle and pedestrian safety, motorcycle safety, and speeding, including in work zones. Item number 7, BL 2024-306 by Coupin, Porterfield, Evans, and others, designates a certain portion of 2nd Avenue North as a tourism improvement zone and to grant the businesses that front thereon certain privileges. Do I have a motion? All right, it's been moved and properly seconded. All those in favor of our items on consent? Anyone opposed? Oh, Councilmember Kimbrough, what is your question?
I had a question regarding, we're on item 5.
You have a question on item number 5.
Is that the one we're on?
I apologize, which,
It ends in 367, RS 2024.
367, you have a question? Let me ask you this, does it impact your vote? Does the answer, could it
Yes.
impact your vote?
Yes, ma'am.
Okay. Can I just go ahead and have her ask the question, or do I need to?
We're in the middle of a vote right now, if I'm not mistaken.
Yeah, do I need to rescind the vote?
And take it off consent.
Okay, everybody, I'm going to rescind my motion for all those items on consent. I'm going to reread actually items on consent, and then we'll take the motion again, and we'll leave item number 5 off. Oh, I see. I've got another person with a question. Let me recognize Councilmember Coopin.
Thank you for recognizing me, though I'm not on the committee. I was going to leave it be, but I do have a late filed amendment on item 7. So if it's up to you if you want me to pull it off consent and explain it, or just leave it for the Rules Committee, but I'll leave that to your preference.
Might as well go ahead and pull it off as well, since I'm pulling. Thank
Pull
you.
away.
All right. All right, so let me reread this really quick. So items on consent are item number 2, RS 2024. Dang it, sorry. RS number 3, RS 2024-360 is on consent. Item number 4, RS 2024-366 is also on consent. Skipping item 5, skipping item 6. Then we land on, actually that's the end because we're also taking off item number 7. So we have items 2, 3, and 4 that are on consent. Do I have a motion for those items? Thank you. It's been moved and properly seconded. Let's take the vote. All those in favor of items 2, 3, and 4 on consent, please say aye. Anyone opposed? All right. We recommend approval for those items. Okay, so let's go back and pick up item number 2, which is RS 2024-351, Coopin, Horton, Huffman, and others. This is a resolution requesting certain departments of the Metropolitan Government provide a comprehensive analysis of recommended changes to increase the safety, security, housing resources for the unhoused and cleanliness of the properties surrounding the Cumberland River within the downtown interstate loop. Do I have a motion? All right, it's been moved and properly seconded. I will recognize the sponsor.
Thank you, Chair, for recognizing me, even though I'm not on the committee. As you heard from Mr. Ryder earlier, there is still some work being done on this resolution. Some of it's already occurring. Some of the things we were asking for in it have already started to occur, and there's some other coordination amongst departments being had. I've had multiple meetings with Mayor's office and the various departments. So I would hope someone on this committee would see it fit to move for a 2-meeting deferral to work on that.
All right, we've got a recommendation for a 2-meeting deferral has been moved and properly seconded. All those in favor of a 2-meeting deferral? Oh, Councilmember Huffman has discussion question. Go ahead.
Thank you, Chair, and this will be a brief comment. I support the 2-meeting deferral as a co-sponsor of this, and I want everyone, especially just anyone that thinks that this is a response to the unfortunate circumstance with Mr. Strain, that did bring light to some pretty unpleasant stuff in regards to the way that our river front looks in this city. But this is not the focus of this. We've got a serious problem in this city, and this resolution simply starts the process to talk about a better way forward. Thank you.
All right, thank you. Any additional discussion? All right, all those in favor of a 2-meeting deferral, please say aye.
Aye.
Anyone opposed? All right, we recommend a 2-meeting deferral. Thank you. Skipping now to item number 5, RS 2024-367, Porterfield, Toombs, and Evans. Approves an application for community-based safety traffic safety enforcement education grant from the Tennessee Highway Safety Office to the Metropolitan Nashville Police Department to conduct sustained, highly visible, and proactive traffic enforcement, addressing impaired driving, distracted driving, occupant protection, older drivers, teen drivers, bicycle and pedestrian safety, motorcycle safety, and speeding, including in work zones. Do I have a motion? All right, it's been moved and properly seconded. Any discussion? Councilmember Kimbrough, you're recognized.
I had a question regarding the sustained highly.
Do you want to use your microphone?
Oh, sorry.
No, you're good.
Okay. I have a question regarding the language. I just wanted an explanation what that meant, like I know what the words mean, but what it meant in this context. The sustained, highly visible, and proactive traffic enforcement that will address impaired driving, distracted. I was wondering also what that occupant protection meant and older drivers. So as the conduct sustained highly visible and proactive traffic as to the occupant protection and older drivers, what does that mean?
Deputy Chief Gilder. I'm sorry? I'm not sure. Which one?
Clerk in the middle.
Oh, clerk in the middle. There we go. Should be on now.
Okay. That's actually the grant language from the state that is in the contract. Metro did not write that, but the grant is for a multitude of purposes related to traffic safety. The state used to parse out multiple grants, and in this case, they have kind of rolled all these into one roadway safety type grant. This is the application for the grant, so it has come to council to both apply for it and to accept the award if we get the award. And this is the application, and what we have applied for to use the funding for is as overtime fund for officers to conduct largely DUI and distracted driving and speed enforcement, which is our primary contributing causes with respect to injury and fatal crashes. That over time allows us to use officers that are off duty so that we're not pulling officers from precincts that are answering calls for service and not causing an impact to calls for service there. And it also allows us to purchase the equipment that's necessary to carry out those duties like laser and radar equipment that allows us to conduct that enforcement. And it also funds some training for those officers as well.
Councilmember Kimbrough, does that help?
No, no, you said this is for overtime? Did you say that?
That's correct.
Okay. I thought it was something else that had to do with overtime, but this one has to do with overtime.
Yes.
Okay, and you don't know what they meant by the highly visible and proactive traffic enforcement? What does that highly visible mean?
I would be speculating as to what the state intended when they drafted that language, but I think they just, the goal often, obviously, with respect to traffic enforcement is to slow down and improve safe driving on the part of the person that you're intervening with, but also for the motoring public that sees that stop occurring, that tends to have an effect on them as well, and I suspect that's probably what they intend by that.
You mean another motorist? What do you mean? So you're saying highly visible means blue lights or something? Is that what you mean?
Again, that's the language that the state used, but I would suspect that's probably what they mean.
Okay, and what's the sustained part mean?
Again, that's the language from the state that they put in the grant application. I think, again, the purpose being to actually have an effect on injury and fatal crashes. It can't be like a one-time enforcement where you go out for 4 hours one time and conduct enforcement. It has to be done on a sufficient enough basis to have an impact on traffic safety. So I suspect that's what they mean by that.
What's occupant protection?
The passengers in the motor vehicle.
Yeah, but what's that, like, protect them how? What do you mean?
But, well, when you're riding with a driver who's impaired or driving at excessive speeds, it places not only the driver in danger, but the other motoring public, but also the other occupants of the subject vehicle.
So the grant protects the occupants in cars. Now, when you talk about older drivers, do you mean how does that all?
Councilmember, this is probably going to need to be your last question because I've got some other people in the queue. So if you could ask that question and then we'll move forward.
That, again, is language from the state. There's a broad array of uses. That's not what we have applied for with respect to anything dealing with older drivers.
You say that's something from the state, so you don't really know what they mean by that?
Well,
I think we're getting into such technicalities. I think in the end, you're probably not going to be able to get all your questions answered. And so you should probably think about, would you rather abstain or would you rather vote against since Deputy Chief doesn't have all the information that you're looking to drill down to?
What were you saying about the older drivers?
Go ahead and answer that one, and then we're going to move on because we've got a time crunch.
I was saying that again, I think that is language that the state used when they drafted the grant contract. That is not ours. And I did not see anything in our application that indicated we would be doing anything with respect to older drivers.
Okay. Councilmember, I'm going to need to move on. Councilmember, I'm sorry, we're really going to need to move on because I've got Councilmember Benedict I need to recognize, and I have to be very mindful of our time today because of the number of people that are cycling through Rules Committee and a variety of, we're going to lose our quorum. And so I need to keep on going so that way we don't lose our quorum. Okay? And we can talk a little bit more afterward if you would like. I'm sorry. Let me move on because we're talking about it more than that. Councilmember Benedict.
Thank you, Chair, and thank you for recognizing me, even though I'm not on this committee. Deputy Chief Gilder, yesterday in the Budget and Finance Committee, you mentioned, or I asked you a question in regards to the tragic killing that we had in District 7 of Mr. Chazen Page over the weekend. And so I wanted to just reiterate for this committee and for the viewing public that this grant of up to $710,000 can be used for traffic enforcement on roads like Gallatin Pike so that we can get enforcement at nighttime, daytime, additional enforcement. Of course, we have 3 E's of traffic. We have engineering, education, and enforcement. And enforcement is something we need more of. I'm calling on your department to give me more enforcement on Gallatin Pike. Just want to confirm that this funding, as you described, if you could expand on how this will help with enforcement of those reckless drivers who are clearly causing dangers and tragedies throughout the city.
Sure. So the way this grant is, it's housed out of our traffic division, and the traffic lieutenant looks at the crash data. So this is spread across a year period. It would start in October. It would end in September of 25. And these enforcement activities are spread across that year period. And before he's assigning those and setting those up, he's looking at the data. And he's looking to see where our injury crashes, where our fatal crashes occurring, and that's where our enforcement activities are directed. So areas where we're having issues with, because throughout the year we get requests from the public, from council members with respect to addressing traffic problems. Those get factored in as well. And so, yeah, that's the kind of incident that that we would be looking at when we're looking at locations to deploy resources for this grant.
Okay, thank you, and thank you again, Chair, for recognizing me.
Thank you, Councilmember Benedict. Any other, Councilmember Huffman? Hold on one second. Okay, you're recognized.
Thank you, Chair. A quick question for you, Deputy Chief Gilder. I believe you said this, but I just want to clarify. Regarding the workforce of every precinct, the funding for this isn't looking to pull any officer from their current assignment, correct?
That is correct. This funds an overtime initiative so that it will not reduce or impact calls for service that are, right, that's correct.
Thank you. And one other question, and it's a very timely observation that I had this morning. I observed, unfortunately, a car just blast through a school zone, doing over 80 miles an hour easily. I didn't see it listed in here. Once again, I know this comes from the state, but just to have it on the record, I would ask that you consider school zone monitoring for that. Thank you.
Thank you, Councilmember Huffman. Any other questions? Okay, Councilmember Gregg.
Thank you, Chair. Just one question based on Councilman Member Huffman's question. So they won't be pulled from officers that are on duty to do this work. Does that work in reverse? If you're doing overtime and you're out working on traffic enforcement and let's say a major incident occurs, are you still focused on that traffic situation? And I ask because to solve this problem, we need sustained attention. So I'm just curious.
Yes, sir. So they would be expected to maintain focus on what the enforcement activity that they're engaged in. Now, obviously, if they had a life-threatening situation that occurred, they're not going to ignore that. But they would attend to it until on-duty resources could respond and take over the situation so that they could return to their enforcement duties.
Thank you, sir.
Thank you. Any other questions? Okay, yes, ma'am. Hang on just a second. Councilmember Kimbrough.
I just recognized and noticed that while I was speaking, you cut me off for someone who's not even on this committee. And I'm bringing this up because you've kind of done that in the past. And I don't want this to turn into some type of biased proceeding. But I'd appreciate if you exhibit the same respect that I tried to show you. I didn't ask.
I will say, first of all, thank you, Councilmember Kimbrough, for bringing your feelings to my attention. I actually appreciate that. And to your point, yes, I did. And that was, I would have preferred to not do that. However, I did recognize Councilmember Benedict. And so I appreciate you bringing that forward, and I will definitely think about that in the future. I think that the biggest message, in addition to what Councilmember Kimbrough is talking about, is I just need to make sure that we're moving forward because we have a very specific time concern to consider. And ultimately, if we get hung up on one person asking a lot of questions, I have to, at some point, cut you off. And I apologize that that is bothering you, but I'm happy to talk to you more about it. And I appreciate it. Thank you. Any other discussion? Okay, let's go ahead and move forward and take the vote on this item. All those in favor of item RS 2024-367, please say aye. Anyone opposed? Are you going to abstain? Okay, thank you very much. All right, let's move on to BL 2024-179, Porterfield, Toombs, Benedict, and others. This amends section 2.44.115 of the Metropolitan Code of Laws to require reporting related to use of force by the Metropolitan Nashville Police Department. I know Councilmember Porterfield is not here. I am going to... Oh, great. Councilmember Toombs, do we have a motion on this item? Get on the floor. Can anybody move this item for us to consider? Okay, it's been moved and seconded. I will recognize Councilmember Toombs.
Thank you, Chair. There is an amendment on this bill that is the result of work between Councilmember Porterfield and Deputy Chief Gilder and MMPD to change some of the language, particularly around including the specific age of minors, allowing an age range for adults. And I'm talking off the top of my head. I just looked at the amendment. It talks about taser discharges, when use of force is within and outside of policy. And then there was one other thing that I have completely forgotten. But to my understanding, MMPD through Deputy Chief Gilder are supportive of this amendment. And so a lot of work has gone into it. And I'd ask for the committee to approve the amendment.
Okay, any discussion on this amendment? I see Councilmember Nash, you're recognized.
I guess this is for Chief Gilder. Do you feel like you had a good discussion and have come up with something that's workable? Because I know there was an awful lot of data being asked for initially that I thought was obviously too much. And have you been able to work that out, okay, to your satisfaction?
Yes. I was able to speak extensively with Councilmember Porterfield, and we were able to work out, I think, mutually agreeable terms here. You know, the department's good with the requested items on the report.
Good to hear. Thank you, Chief. Thank you, Chair.
Okay, thank you. Any other discussion on this amendment? All those in favor of this amendment, please say aye. Anyone opposed? Anyone not voting? Okay, you recommend approval. So we're now on the bill as amended. Any discussion on the bill as amended? Okay, seeing no discussion. All those in favor of the bill as amended?
Aye.
Anyone opposed? Anyone not voting? Okay, you recommend approval. Okay, with that, we are going to transition. It's right at 4 o'clock. I know some of you need to leave. Oh, I'm sorry. Number 7. Hang on a second. I'm getting, oh, I see. Yes, I almost forgot. All right, let's get, we're almost there. BL 2024-306 by Coupin, Porterfield, Evans, and others. This designates a certain portion of 2nd Avenue North as a tourism improvement zone and to grant the businesses that front thereon certain privileges. Do I have a motion? All right, it's been moved and properly seconded. Let me recognize our sponsor, Councilmember Coupin.
Thank you for recognizing me, even though I'm not on the committee. I'll be incredibly brief. Just wanted to let everyone know I've got a late filed amendment. It takes out just one section of this bill. You'll hear more about the rest of the bill on the floor tonight. But it takes out the section that makes the bill close the road. The road is already closed due to construction, so it's kind of redundant and might have caused some problems down the road. So we're just taking out the piece of the bill that says it's closing the road. The rest will still stand, and I'll talk more about the rest of the bill tonight, unless anyone has any questions.
All right, is there any discussion on this? It looks like Councilmember Nash has a question.
Thank you, Chair. It's been a little while since I read this, and it seemed like initial reading, if I remember correctly, they could put wares out on the street, and I know we've been trying to keep our streets kind of cleared. And is there any concern over that by the sponsor?
Let me recognize Councilmember Coupin.
Thank you for the question and the recognition. So this bill would allow the businesses specifically to put wares out, but it would still have to be approved through NDOT. So NDOT is the force driving this bill, and they are monitoring and approving permits. So there is a lot of work, and I appreciate the recognition of that, to clear some of the sidewalks downtown. This is a very curated approach for certain businesses in that space, and NDOT is supervising and supportive.
Thank you, Councilmember Coupin. So I guess my question to you is, what is your intent for this committee? Are you interested in us moving approval?
Yes, move approval would be great.
Okay. All right, then. So we have could I get somebody on the committee to move approval? Thank you. It's been moved and seconded. All those in favor? Anyone opposed? Anyone not voting? All right. Now we will transition, thank you, everybody, into our presentation. And so I will turn it over to Deputy Chief Gilder to get us started.
Sure. All right, thank you. So this is the very similar to the presentation, if you were around or if you were tuned in last August, that we provided to the council at the conclusion of the LPR pilot program. And as you may recall, we ran a 6-month pilot in the first half of 2023 where we had a limited deployment of LPRs. And at the conclusion of that, we presented a report to council about our findings with respect to the functionality and the results of that program. And so we wanted to, given the fact that there are LPR contracts that are moving through procurement and will probably come before this body fairly soon, hopefully. We wanted to kind of go over this again, just so in case anyone had questions, or to refresh everybody's recollection about the pilot program and how that worked. And this is Deputy Chief Blair, who oversaw the pilot program, and he's going to help present.
Good afternoon.
Thank you, Ron.
Good afternoon. So we'll get right into this. So this is the kind of the questions at the beginning of the program that we asked ourselves: does the technology work? Yes. Technology's been around since the 1970s. Started off in Europe, it works everywhere in the country, and it worked here. Does the ordinance meet the community's needs? Yes, it does. The ordinance was very well written, gave us very good guidelines and foundations. When we went to the community meetings to ask questions, we were able to stand on something very found and say, no, the ordinance says we can't do it, and this is what we follow. So that really helped us out. The policy is basically written to meet the ordinance because the ordinance is so well defined. That helps us to generate the policy. The best way to deploy the LPRs, we'll get into that a little bit here, but that did help out. What we learned a lot during the pilot program. And then the managing of it, we learned a lot. And then the vendors. We asked for all 3 vendors to move forward because that puts the city in the best position always. If you're dealing with one vendor, then you kind of have to deal with that one vendor all the time. If you have 3 vendors, it gives the city options. So first, we're going to talk about some victim impact here, and these are all very specific. The very first one is based on historical data searches. This crime occurred, this lady was sexually assaulted, and the evidence that was collected was through the historical search to get the license plate that led to the lead to apprehending this individual and getting him arrested. Without that, we never would have solved this crime. The second one was a domestic kidnapping and robbery. The big thing about this case is this lady's car was taken in October of 22, and we didn't recover the car until March. She went that many months without her car. That's a long time to go without someone's car, and I'm sure that car was used in a variety of different crimes. And the last one is, just to kind of show out, this is a problem all over the country. This car was stolen out of Florida, and then it was recovered here at First and Koreans Veteran Boulevard, which had a lot of hits in that location.
Before you move on, just to refresh everybody's recollection, the LPR system functions in two main ways, right? It either it alerts on a tag that passed by it that is entered into NCIC, for instance, like stolen vehicle, stolen tag, and it alerts us to the fact that that tag just passed by that LPR camera. That's the example, the last example you saw there. The first one is the other functionality of LPR, which is the historical data. So a crime occurs, nothing about that tag flagged the system, but a crime occurred and the suspect vehicle passed by that camera and was recorded by that camera. And by ordinance, we were allowed to hold on to that information for a period of 10 days. And if within that 10-day period, we discover that that there may be information contained there that would assist with the investigation, and there's the types of crimes that we can utilize it for defined by your ordinance, then we can go in there and look through that data for that tag, and that's what that first example is an example of. So.
Yeah, thank you for that. And there's a process involved in that, right? They have to submit a form, and they basically have to give their probable cause why they want us to search that. And during the pilot program, we denied a lot of requests because the information was not there to search. They could not articulate, so we did not search. This is the results of the pilot program. You can see over $1 million in cars were recovered. 87 vehicles were stolen, so when you divide that in there, we're talking about average price of the car was $12,000. Value of the car that was stolen, and 112 arrests. We created some definitions that to go off of, and I think this got kind of confusing to people, and the reason we had these definitions is to define the program, but also show the pattern. So your camera reads are always going to be the highest read, and how that narrows down to what we're addressing. In 2014, we made over 414,000 traffic stops. During this pilot program, it read 71 million tags is what we estimate. That's 512 tags a day at 24 fixed locations. And we only arrested 112 people, which is actually exactly what we wanted it to do. And it did that. And so how this process works is the camera, as the car passes through, it reads it very fast. It reads the camera, takes a picture of the letters and numbers, and then it matches against NCIC. That's the only database that it runs against. If the NCIC picks something up that we need to be notified of, it sends us a hit that we need to look at it. Once we get it, we have 2 officers that must verify it, or 2 employees that must verify it. They must agree that the letters and numbers in the state match the system, that it matches an NCIC when they run it. And if they both agree, it's a verified hit, and we send that out to the officers in the field to try to find the car. This process is no different than someone calling 911 or the 8600 number and asking for police services. You still got to find the car and go through that process. It just helps us so that we can focus on other things, and this runs in the background.
Real quick, so that before anybody in the field knows that this tag is hit on the LPR system, there are 2 people and the Community Safety Center that have reviewed it and verified it. So that eliminates the issue that sometimes people ask about with LPRs, which is the issue of misreads. And this way we have 2 people that have to look at it, agree that it is the letters and numbers, it is the appropriate state, and that the hit can confirm that hit before they ever communicate it out into the field for any action to be taken on it.
And outside the hit, if no one knows about the hit, right? Only the center knows about the hit. No one else knows about it. So if it doesn't work out or it's not valid, it goes away, the data falls off, and no one knows about it. So that's a good part about this. The dual verification, the reason we came up with this purpose was a lot of concern about misreads. And we heard that from the public. So we thought, let's just take it off the table from the beginning. And that's why we came up with this system. So when something comes up, there'll be a lot of words here that'll tell you, the owner and the car and all that in there. We took that out. This is one that was recovered during the pilot program, but this just shows you what the camera shows you. It shows you the plate and shows you the car. And this is what the officers see that they have to verify. So an LPR is the #1 precision policing tool. It's the third pillar in Chief Drake's vision for the police department, and it just reads plates. That's all it does. It doesn't tell anything else. And 71 million reads, and we arrested 112 people. Out of those 112, we've dealt with 103 before on multiple occasions. For 15 years, been 29 arrests. And then you can see the different charges there down there, pretty serious charges. And you probably see that 371 are drug charges. Right now, homicide and a lot of our shootings are over drug situations. Another thing we learned after the pilot program ended in July 22nd, so we took some data and we looked at our crashes. So there's just under 2,900 crashes in that 6-month period. 57 people were seriously injured during these hit and run crashes. 655 just had some minor injuries, but there were 10 fatalities. And out of those 10 fatalities, we can do a historical search to try to find a lead, that plate registered owner, so that we can give that to the investigator to do some research. We still have 8 unsolved cases where if we would have had LPRs, we might have been able to help those investigators solve these crimes. Right now, these crimes are just sitting there and they're not being solved because we don't have the investigative leads to move forward. And here's some examples. It happens all over the county. 1700 block of DB Todd. There's no physical evidence that's this one at all. No cameras, no crash debris or nothing. We put out a bunch of media releases to the community for help, but has come back with nothing. Central Pike and Holder Boulevard, we do know the vehicle, what type of vehicle it is, but we don't have a license plate. Again, media releases did not generate any leads for us at all. And then the last one, the reason this one's up here is we had an LPR at this location at Murfreesboro and Thompson. Lady was getting off the bus, walked across the street and was struck. And we did get cameras out from our safety cam that was there, and then from the local businesses. It gave us a car. We put that out to try to generate leads from the community, but that didn't do anything. The LPR gives us that tag, and when you get that tag, you get that good lead. And what our investigators across the department, if they get 1 or 2 leads, they can end up solving that case. And this just makes it more efficient.
Yeah, just to clarify, when he said we had an LPR at that location, he meant during the pilot period. This unfortunately occurred after the pilot period, and we did not have an LPR there to use and to help solve that offense.
Yeah, just so you know, there are no LPRs working by Metro Police at this point in time. The pilot program is totally over with. And this just kind of gives you a map of those injuries of hit and run locations. Kind of tells you where they're occurring at. And the yellow is the injury and the red is the fatal. And then here are the fatal locations. And again, these are the injuries. You see some of them come up multiple times. We'll cover this just a little bit here more in detail, some of the injuries they have. So when it came to the quadrants were determined. We had to have 4 equal quadrants, and we did that by population. The reason we did it by population was the current concern over privacy. Everybody was very worried about their privacy, so we focused on population. We thought that would be more beneficial to the city. And everything else was pretty close, but that's how it came out. In quadrant A, when I first came on, that was 1 precinct. It is now 3. So that was generated off of violent crime. Just over 13,000 violent crimes were occurred during that 2-year period. They pulled the numbers. Over half of that crime was within a half mile of the 47 potential LPR locations that we could have selected from. And the crimes that we looked at were homicide, rape, robbery, and aggravated assaults. And we overlaid that, strategic development, overlaid that over the collector streets and major arteries to come up with our intersections.
Can I pause you one second? Sure. Just as a reminder, the LPRs are only allowed to be deployed on major collector streets. So they cannot go in neighborhoods, side streets, things like that. So that's why we were utilizing the correct collector street map to overlay that. So
we came up with 47 locations. And 14 were in quadrant A, 11 in B, 10 in C, and 11 in D. So we were going to do 40, and we found out that was going to be very, very burdensome on the vendors. So we cut it down to 24. If you look in quadrant A, there's more there in quadrant A, and I very easily could have picked all the locations and put them in East Precinct and would have been within the ordinance. I still did not think that was fair. We talked about it within the department, and we put 2 in each precinct to make that across the entire A quadrant. And this is what it looks like on a map of all the locations that we had based upon the Part 1 violent crimes.
It can be hard to see from this distance, but basically the heat, the darker colors, what you're seeing is called a heat map. It means there's a higher density of Part 1 violent crimes in that area. And when you get up closer and you can see this, there's dots almost within each of those areas. Those dots signify where the cameras were deployed, and that just kind of signifies that we were deploying these over those locations that we identified that were high in Part 1 violent crimes.
And here is where the selections were made. Excuse me. And they're still in the same quadrant, 24 locations. So again, we stayed within the rules, basically just simplified it, that we're putting it out there. This is what we use the LPRs for, nothing more. During the pilot program, we did not have any silver or amber alerts. I wish we would have, because we could have maximized that portion of it to show that. There has been a lot here in the recent months that would have been helpful for that. During the pilot program, this was the equipment that we used. 24 fixed locations. They were solar powered, and data was moved by cellular. There were 10 mobile. They were divided across traffic in the patrol divisions. And then we had 7 trailers that we used during the pilot program. We kind of broke it down by quadrant here for you, just to kind of show you the location and the reported crime numbers. The ones that are highlighted in the blue, those are the locations that were selected for the pilot program. That's quadrant A. That's quadrant B. And if I need to slow down, please let me know. That is quadrant C. And that is quadrant D. Also, planning and research looked at this, and they suggested that the LPRs were focused in violent crime areas and hotspots like we intended to be. This is just a rough look at the locations of August of 2023, looking at the house sale prices in each of those locations nearby in that general area. A lot of questions that we went out to the community groups and different meetings that we met with people. The immigration was asked a lot of questions about that, and so was the data. The ordinance prohibits us to use it for immigration enforcement. We don't even turn on that file for the immigration file in NCIC. It's not even turned on. We have no idea who's who. And then the LPR data deletes in 10 days. As for data management, only people in the center see those hits. The 10 employees that can do historical searches all work for me. And the LPR data is only held, like I said, it's only held for 10 days. There is an option in the ordinance if we believe that we need it for, let's say, a homicide or a fatal crash, and the investigator submits the form with their probable cause for why we need to hold it, then we can actually hold that data, look for a search if we find something, hold that for them for that case. But other than that, we can't, it's gone. There was a lot of concerns about the locations that were picked during the pilot program, so we looked at a possibility of a maximum growth, but as a coverage model. We went around to our advisory groups for all the precincts, and we took their feedback. I think there's about 58 locations, additional locations that people gave us. And this is what we came up with, which would be a total coverage model for the entire county. Now, trying to put that up all at one time would be very cumbersome. So we looked at another model here. This one's based upon 16 major intersections across the county, 4 in each quadrant, and then the supporting intersections that support that. So one thing we learned in quadrant A was so successful over the other quadrants is they were kind of in that L shape that comes up there, and we were able to determine the direction of flight. So the first time it hits an LPR, it just tells you that you have a problem, right? The second time it hits an LPR, you got a direction of travel. And if you get a third hit in your location, you can really just hone in on that direction of travel. And that helps you to find the car. Down at, Murfreesboro and Bell, that was the number one highest active location for the LPR, but there were no supporting sites there. And that's why there wasn't a lot of success down there. You have to have those supporting sites. So this model right here, we're looking at the major intersections and how do we determine a direction of travel. This is looking at about 160 to 200 cameras. It depends on the technical perspective when we go to put this together. So we're just kind of kicking this around to see how this would work to get this implemented. And it still gives good coverage. It's still high. This is based on 6 data points in the whole thing. It's based on the recommendations from the community groups and what we see as a department, the major collector streets and arteries throughout the county by NDOT, TDOT's annual traffic numbers that they have. So we're looking in North Precinct while we were up there. The one gentleman brought up about high traffic areas. Why aren't you in there? So we took that into consideration to make this. And a lot of them came back with the same points that we had during the Part 1 crimes. And it came back the same. Community recommendations in our violent crime heat map, and then where we already have safety cameras at, there's no reason to put an LPR there if we have a camera there. Basically, if an LPR hits, you could always check that camera to see if you find that car that you're seeing.
Let me ask a question real quick. Do you, because we're getting so tight on time, would you object if we stopped the presentation for now so I could see what questions people have?
Sure. No, ma'am. Go ahead.
Okay. I'll take, I see Councilmember Huffman.
Thank you, Chair. Just a quick question regarding the availability of the data. You had mentioned that it is around for 10 days.
Yes.
I want to give you a hypothetical. I don't even know if this is possible or not, but if there is a violent crime that happens, let's say in my district near Central Pike, and there's a hypothetical camera at Central Pike and Old Hickory Boulevard. However, the crime is not discovered until, like, let's say someone is murdered, and the body's not discovered for 2 weeks. Is there any instance where the data can be retrieved to help with that? No. Okay.
No, it's gone.
Okay.
So once that 10 day, it's a rolling 10 days. So every day that 10 days falling off.
Okay.
And there's plenty of times that we looked during the pilot program. We had a couple, one was a fatal crash. I think one might've been a homicide. They asked us to pull the information and it was gone. We couldn't help with it.
Okay. Okay. All right. Thank you.
Thank you, Councilmember Huffman. Councilmember Nash.
Just to give some of our newer members some context, there was a major debate about how long we would keep the data. Several of us wanted a lot longer. I think the state allows 20 days.
I believe
90 days.
Yes.
The state allows 90 days. But again, because of the privacy concerns within our community, we kind of got it down to 10 days to get the project passed.
All right, how many other questions out there? Okay, I can give you probably another like 2 to 3 minutes if you've got anything else to.
I got a video to play from News 2 that they've seen on the news.
A video? You mind if we skip that? Wait, actually,
I
let
go
me.
to one more slide.
Okay, let me ask you another question. As far as this presentation, is this publicly available? And
Yes.
can you also email it to me so I can make sure the committee gets the
Yes.
link?
If you could all do me one favor, though, this is the email address for feedback. We're not getting a lot of feedback from the community. If there are concerns or even questions, I would love to have the feedback. Just email that address, and it goes to 6 or 7 people that were monitoring it. There hasn't been anything sent in probably 2 months.
Thank you, Deputy Chief Blair and Deputy Chief Gilder. So one of the things that a community member reached out to me and had asked if I had included the Community Review Board in this conversation. I did not. I welcome them to come back at another point that we coordinate for any kind of feedback that they'd like to provide related to the pilot program. I do see Deputy Director Johnson in the back. Deputy Director, if you or anybody else from the Community Review Board, if you'd like to have just 2 or 3 minutes, I'd be happy to recognize you as part of a department update. And if you could let us know who you are. Oh, Jill, Director Fitchard, I recognize you.
Hi, how are you? So we are going to be meeting with the mayor's office on Monday with the police department in collaboration with them and a community member to talk about LPRs and the placement. My concern has always been, and I brought this to your attention, as we talked about the pilot program, that is the placement, the perception, and then, of course, the policy. And that still remains the same. I think that we have some ideas to strengthen the policies, to protect the citizens, but also to make certain that the police department is taking care of the 10-day, there's a 10-day retention, and we just want to make certain that those things are being taken care of the way that they're supposed to, and that there aren't any retention problems and any auditing issues as well. So thank you for that.
Thank you, Director Fitchard. I appreciate you coming. I did not see you. You were hidden behind a chair, so thank you for coming up. Next, and you all are welcome to get up if you would like. You don't have to stay up here at the front. But Tom Sharp, I would love to recognize you for some of the questions that I've emailed you about. Do you mind? Do you have that information? Okay, great. Come on down.
I have better than that, Madam Chairman. I have somebody that actually knows the answers.
Okay, awesome. Very good. Hello there. Could you identify yourself for the viewing public?
I will. Good afternoon, Madam Chair and members of the council. I'm Dr. Nidley Melville Chester, the Division Director for Behavioral Health and Wellness at Metro Public Health.
Thank you very much. So some of the questions I had gotten that I had forwarded over to your office that you had responded and given me information via email, I just wanted to be out in the public, were around 2 particular programs. One was the Department of Justice grant that you all had been awarded, and then also an update on the community safety program that started under the Cooper administration.
Okay. Thanks, Madam Chair. So first, I'll go with the DOJ Bureau of Justice grant that was awarded to the mayor's office in November of 2023 and then got transferred over to Metro Public Health on December 9th. That grant, it took me quite a couple of months, as I said to you, an award is an award, and then we have to go through the budgeting period and create a budget for it that's aligned with Metro, with staffing, with all of that. We've done that. And as of March 31st, we got the budget approved. Since then, I've been to Chicago with BJA for a whole week with all the new grantees and looking at all the parts of the program that we need to implement. Excited to say that we have hired our 3 creditable messengers, our case manager. We're interviewing for the performance and management manager now, and interviews will close on Friday for that position. And so we're in a good place for implementation to get started with the project. We'll visit Chicago, Miami, which was recommended. I'll take the staff there to look at their best practice program in Miami and to help with some training to get us started in that program. So we're in a good place with BJA. They're happy with our progress and we're moving along.
Very good. And then on the community safety grant awardees and kind of where things are with the continuation, I guess, or hoped continuation of that program.
Well, I'd say where things are is we finally got all the funding transfer to Metro Public Health. All of the invoices that were outstanding since October of last year has been paid up to February of 2024. And the March invoices were submitted this week, and they're in finance for payment. So those program continues. Some of the contracts has expired. So we are trying to figure out now how do we re-up some of those contracts. I'm sure we'll be coming back to the council with that. And of course, the one I mentioned to you, John Jay, that was a bit of a struggle, but we believe we have a solution to that, and that should be resolved pretty quickly with them. So we'll continue there. Our community safety program continues. We have closing for a project manager for that position closes tonight at midnight, and we'll start the interview process to continue with that program. We're also advertising for the vendor contract manager position there. So all 21 vendors continue to do the program as came over from the mayor's office, and two of those contracts expired, and we're looking at the process for refunding. As you know, the Metro process is a little different from the mayor's office process, so we're taking that through legal and looking at what we need to do to continue those programs.
Very good. How about any questions for Dr. Melville Chester from anybody? Okay. Thank you, Dr. Melville Chester. Would you also share the information about the dates for the behavioral health event that you're holding?
Thank you so much for that. Yes, on April 23rd and 24th, 23rd beginning at 5:30, we're kicking off our Behavioral Health and Wellness Summit for Nashville, Davidson County. It is an exciting time for Nashville, Davidson community and for Metro Health Department. The Honorable Patrick J. Kennedy will be here as our keynote speaker on Tuesday evening. And on Wednesday, our own Mayor O'Connell will be our keynote speaker. We have just a myriad of workshops all day on Wednesday. We're inviting you to come to spread the word to your, I think Madam Chair has the email. Most of you should have gotten an invite with a QR code. Use your network to have individuals register for the conference. One of the big issues that have come up is around xylazine and fentanyl, and I'm excited to say that I reached out to the Public Health Department Director for Pennsylvania. They have the cutting edge program there, and he's sending two of his staff here to be on a panel to discuss with us how we manage xylazine and fentanyl and working with police to make sure we're decriminalizing those overdose issues, but we're doing more around counseling and mental health services going upstream to look at root causes. And so that's a fruitful discussion. Also, the morning of the 23rd, we're doing a leadership breakfast. Invite you to come to sit around the table with the mayor, with Patrick Kennedy and other leaders here in Nashville, Davidson County to look at how we continue to impact safety, opioid use and misuse, suicide prevention, and mental health services for Nashvillians. Thank you so much for your time and giving me an opportunity to speak.
Thank you. I appreciate you being here today. Mr. Young, do you have any department updates, anything that you need to share? Okay. Any other public health and safety department? I see Director Calvin in the back. Do you have anything you need to share with us?
I know it comes really fast. Seems like we just did this. Hi.
Hello.
Director Calvin of the Office of Homeless Services. Nice to see you all again. It's time for an update for our Housing First initiative. Not much has changed other than a couple of housing options coming online that we're super excited about. I think if you turn to page 7, I forgot to email you directly the copy. Mr. Bill Clendenning is out on vacation in Disney with his grandkids. So he left me to my own devices. So once you get the document, you'll see on page 7, there's a couple of locations, Urban Housing Solutions and Being a Helping Hand. Those 4, which is a total of 21 units that came online in a short amount of time. That also includes a much larger portion of units that are online as well that our clients can utilize with their voucher. Another thing I do want to highlight is Shelby House. They have 2 projects, total of 14 units that will be coming online really soon, which also includes another 195 units that will be online. Excited about that. And that is through Holiday Ventures. And they're also going to have a grand opening or a groundbreaking for the Joseph, I believe it is there off of Joseph and Gray Street. They have some units that they're about to start building. They're great partners of ours and actually looking to provide some project-based vouchers through MDHA and not even utilizing the vouchers that we actually have in our pipeline. So it's really great. That is really great. I think flipping through here, you'll see just a little bit of movement. As far as encampment closures, we have not focused on the next encampment as far as closing date, but we are assessing people in that location, making sure we have a really robust by name list for everyone in that location and ensuring that everyone's in our coordinated entry system as well. I think that we have a lot of housing coming on, so we want to make sure that we are processing situations as they flow, as far as like housing coming on, and then keeping our eye on what the next move is. I believe one other thing about the encampment strategy, I think the COC community has tasked OHS with either revising the work or putting a one-pager on top to address kind of like the bullet points of how to do an appropriate encampment closure. And so we're excited to do that. I've tasked my team with championing that work and wanting to make sure that as we move forward with budget season funding requests, that the work is aligned appropriately as well. One last thing I always want to highlight is the very last 2 pages. This is our HMIS data. And thanks to Councilmember Huffman, he informed us that this was great information that we should share with you all. We talked solely about small encampments or, encampments that we've closed. I will say there was a report that was pulled, before I talk about this, there was a report that was pulled that spoke to comparing numbers from this year versus numbers from last year. I think there was concern that as we were looking to address encampments, that could cause some equity concerns, meaning that here locally in Nashville, people that live outdoors typically are white or Caucasian. The people that are living in shelter typically are Black or African American. And in pulling that data, we were able to review, and we're still in alignment for the last 2 years with housing a majority of those that are Black or African American, and looking at the disparities in the total population or our census. I think that was important for HUD, definitely important for our local service providers as well. And not much has changed in that within the last 2 years, even with the encampment strategy. So that was some great data to review last night. One last thing, looking at the overall data, the last 2 pages, on page 17, you'll see that within the year, within this month, for the month of March, so not this month of March, 3,598 people were experiencing homelessness or entered into our HMIS system or reached out to us through a coordinated entry system. And if you'll see on the back, 131 of those individuals were housed. I'm proud to say that within the last 2 years, we have averaged housing at least 36 or higher of those that are experiencing chronic level homelessness, which is the definition of having a disabling condition and living unsheltered or experiencing homelessness for over a year, or another definition with the same disability component, but the length of time, which is 3 years with 4 bouts of homelessness. It's a lot of information, but hopefully, you guys are seeing great progress there.
Thank you, Director Calvin. I actually got asked this question today, and I know the answer, but I'm going to ask you because you also know the answer, but I think anybody watching may be interested in making sure they know what to do. If you are in public and you meet somebody experiencing homelessness who needs assistance, what is step one when you meet someone in navigating that?
Step one, it would depend on if it's a family or if they're an individual. If they're a family, there's a centralized line, 615-862-6444. That's the line for family. So if you have anyone that has a family with any minor child experiencing homelessness, that's a universal number that you can dial. If there's an individual, I would say reach out to our office. And I should have that number memorized. I don't, but I'll send it to you in an email here shortly. But it's a line that reaches out to our outreach team, and our outreach team would either go to that location. Third way to do it is Hub Nashville. Hub Nashville, there is a link for homelessness, and you can utilize that. And then our outreach team will deploy services to that location as well.
Thank you very much, Director Calvin. Anybody have any questions for April Calvin? Okay, I appreciate your time. Any other departments that need to share an update? Looks like I have caught everyone. So with that, I will entertain a motion to adjourn. All right, thank you very much.